Healthcare careers shouldn't be a mystery, and they shouldn't be reserved for people who already have connections or know the right people. My name is Tanvi, and this is Healthcare Unveiled, where we have honest conversations with healthcare professionals about their real journeys, the good and the challenging parts, so you can figure out if and how this path might work for you. Today we have Dr. Aliya here. Thank you so much for being here.
Thanks, Tanvi. I'm excited to chat with you.
Me too. How are you?
I'm doing good, thank you. It's been a fun full day.
Mhm.
And how about you? How are you doing?
I'm doing good too. So just to start off, can you introduce yourself and talk a little bit about what you do and what field you're in?
Yeah, so what I do currently is I have a private community where I offer integrative and more so like Ayurvedic and Eastern medicine practices. And so I see people in different capacities. So either consultation based, which is one-on-one, and then I also offer group classes and sessions. So right now, currently, we have like a 6-week program running where we are going through things like hormone health, gut health, and then nervous system rebalancing. And so kind of teaching people about their bodies, how things work in the body, and then also ways to observe themselves so that they can start finding their root cause and then treating that themselves using just lifestyle. So my focus in what I do right now is really based on lifestyle medicine, looking at the root cause and then integrating things mostly from the Eastern aspect of medicine.
So what initially drew you to medicine, and when did you specifically become interested with integrative medicine?
Okay, so when I went into medical school, I had initially started as a nurse, and I've always been curious about healthcare. And so I thought, okay, maybe, as an undergrad, it would be good to go into nursing, and then I will be able to see that other aspect of the healthcare system. And so I went into nursing for that reason. And within a few years, like actually in the first few semesters, I realized that I wanted to keep learning more. And so I already knew that I would set my sight for medical school, which I initially thought was how you would learn about how the body heals. And so that kind of got me into medicine in the beginning. And once I got into medical school, I realized that I wasn't specifically learning about how the body heals. It was more so just like, basic information about the body. So we learned really great basics and foundations like anatomy and physiology, biochemistry, and, things that allowed me to kind of put into perspective the whole system of the body and a little bit more detailed than what we did do in nursing. So it was like a little bit bigger of an overview. But then as I started to go through it, I remember we were in pharmacology class, and so we were learning about different pharmaceuticals. And we came up about the statin drugs. So these are the anti-cholesterol medications. And I started to think, I was like, well, why do we need a medication for something that could be resolved with just lifestyle change? And so I asked a question about, the statin because as you may know already, when a statin is taken, it blocks something called HMG-CoA reductase. It's the enzyme that it blocks. Now, that enzyme is responsible for blocking LDL cholesterol production in the liver. But that enzyme also allows your body to use CoQ10, coenzyme Q10, to allow the mitochondria to produce energy in every cell of the body. So I thought, if we're shutting this down, then people are not going to have the energy aspect, right? And then we're also shutting down LDL cholesterol. So wait, why does the body make LDL cholesterol in the first place? So why would we shut down something that was naturally done? And so I got really up in my head, and when I was asking questions about this, nobody could give me a straight answer. And so I felt really frustrated. And that was like, I actually called my dad and I was like, I think I'm in the wrong field. Like, I think I've gone into med school and I thought I was going to learn about how the body heals, but it's so much pharmaceutical based, and I don't find that there's a balance. And I felt really lost. And having an Indian dad, when you say you're quitting med school, they're like, no, 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 you're not quitting. And so I kept going, and he's like, you'll find your way through it. And then he later shared a book with me that he had come across called The Five Forces of Wellness. And it was written by a doctor, an MD. And his name was Dr. Mark Hyman. And he was talking in this book about these different lifestyle factors that actually help the body heal, where you don't need pharmaceuticals to kind of intervene. And I was like, okay, this is making more sense to me. And, so I decided, I was like, okay, well, if he's an MD and he's done this, then I have another track to follow. Like there's somewhere for me to go with this. And so that was kind of the start of my journey into integrative medicine.
Mhm.
I can go further on to that if you want, but if you have another question, then that's fine too.
I was just gonna ask kind of like to continue on with that. So you started off with med school, but how did you kind of, in terms of training, how did you go into integrative medicine?
Okay, so while I was in medical school, actually, I started reading books like this. So The Five Forces of Wellness was the first one, and it was maybe after my second year of medical school where we started doing more of the clinical rotations, and I was feeling terrible. Like my own health was like really struggling. And I remember waking up and looking in the mirror one day and just crying because I looked so much older than I was. I was in my early 20s and had bags under my eyes. I looked like I was at least 50. I gained weight and I was so tired. Like I would sleep 8 hours, wake up and feel exhausted. And, you know, with the amount of studying that you have to do for medicine, and it was just like I would read stuff the day before, and the next day I wouldn't remember anything that I'd read. So my brain was foggy. I didn't feel focused. I had started getting cystic acne. I'd always had clear skin, and I was like, something's wrong. Like something really doesn't feel right. And I remember, you know, because I was surrounded by doctors all the time. We had our attending doctors and then we had our colleagues and all of this. And so I remember talking to one of them and I was like, yeah, I just feel terrible. And they're like, well, you know, for the acne, you can take this antibiotic. And for you know, the way you're feeling, you're tired, you probably have a thyroid illness. So, you know, take this medication for thyroid. And then I'd also mentioned that I was feeling depressed and kind of low. So they were like, take an antidepressant and your hormones are probably off. And so take a birth control pill too, just to be on the safe side. And I was like, I can't, like, you know, I was given like these suggestions for 4 medications. And I was just like, that's not what I want to do. Like, I don't want to be on meds. I'm too young and I don't feel like I need all of this. I feel like I need a way out in healing. And so that was like a big spark for me to start looking. And like that book really started helping me to discover what I could do as a change. And so I started looking at lifestyle changes. And so I was like, okay, maybe it's in the food that I'm eating, right? So I started looking at the Western food system and what foods were considered inflammatory and what weren't. And I read a book called The Paleo Solution by Rob Wolf. And it's an excellent book because Rob Wolf, he writes in the most beautiful way. It's very simple and very easy for the layperson to read and understand. And the way he talks is hilarious. So it's enjoyable to go through, but he really describes how we evolved eating certain foods and how the food industry has changed. And so I was really into this. And so I changed my diet. I got rid of these inflammatory foods. And when I started to notice that change, I was like, okay, there's something to this. And within about 3 or 4 weeks, my skin had cleared up. I was sleeping better. I woke up I had more energy. And like half of the things I was dealing with were already 75% gone. And I kept going with it. And by 3 months, it was like I'd never had those issues to begin with. And in fact, I started to feel even better than I had ever felt in my life. And so I was like, gosh, there's like something to this. So I just took what I had learned and then started applying it to family members. So, you know, one was my mom. She had lupus and rheumatoid arthritis and was put on medications when I was pretty young. Like I remember as a teenager, when she was on methotrexate, Plaquenil, which is like hydroxychloroquine, and she was taking prednisone quite often. And I remember after she started the methotrexate, she became so depressed and she would be in bed most of the day just because her joints would be so stiff and painful. And I remember just crying because I was like a kid and she was telling me that she wanted to kill herself because these medications were just bringing her down. And so when this change happened for me while I was in med school, I was like, okay, maybe this is something that'll help my mom. So I started to experiment. And my brother, who was already looking into these alternative ways, he started my parents, because I was away, he had started my parents on this health food diet and change. And so we both supported them as they went through that. And within 3 months, Tanvi, like she turned around. Like she felt so much better. She eventually, after a year of following this, She came off her meds. She started to improve. She had no more pain. She was living a better life. And it was like nothing had ever happened. Like it was just so amazing. And so then I started to put this into practice while I was still in med school. So when I would see my little patients, they would give me like a small amount of patients to see. I would start talking to them about lifestyle change and like, these are options that you have. And I started to see these changes take place with people. And I was like, wow, there's something to this, right? This is like really working, and you don't need medications to keep the system band-aided. So I thought, okay, well, let's keep learning. And so it just sparked my learning for more. So you asked about, what other integrative modalities or how did I start to get that incorporated? So in med school, I just read as much as I could. There wasn't much time to do other programs because medical school is so heavy, right? But then when I went into residency training and I did family medicine, I went into a program that offered an integrative fellowship while I was studying. And so this program was made by Dr. Andrew Weil. I believe he was the first one to come up with a program for doctors on integrative medicine. And so his program is through the University of Arizona. And so it gives you like a taste, and it's a 2 to 3 year program, depending on how you structure it within the residency program. But this program lets you go through study on all of these different modalities that are outside of our allopathic system. So that included learning about Chinese medicine. It included learning about Ayurveda. It included mind-body practices. It also talked about manual therapy, so things like manual manipulation, so osteopathy type of practices, and many others, like just even different lifestyle tools like nutrition. And the really great thing that they offered within that program was access to something at the time that was called the natural database. And so it would allow you as a doctor to put in medications that someone was taking, and then also add in herbs or other supplements that someone might be taking, and be able to see like what kind of interactions there could be. Mm-hmm. And also to really pay attention to interactions between all the medications someone is prescribed, which a lot of times doesn't get done because, in our medical system, when you have a family doctor, you go to a walk-in clinic, you get like 10 or 20 minutes tops, right? Yeah. And so in that time, who's actually looking at that list of interactions for you? Nobody does it, right? But that is so important because that can tell you what problems are being caused just by that list of things. Anyway, so going back to this program, it was a really good opportunity to get a big scope of what's possible outside of allopathy. And so that was my first kind of broad taste of things. Now, growing up in an Indian culture, and you might know this too, is like you have grandma's therapies all the time, and growing up with natural ways of healing, even using certain spices to help with digestion and things like that. And so I was really, really grateful, and still am, of having that cultural upbringing. But I grew up with taking it for granted, because a lot of times I thought everyone knew these things, right? Yeah. But no, nobody really grows up. Not everybody grows up with those things, and maybe from different cultures they have their own perspective of that. But that sparked me, my own culture sparked that interest in Ayurveda. And so I took that study a little bit further, and I did it through different various teachers. So I studied with Dr. Vasant Lad. He's an incredible Ayurvedic practitioner. And then I also, eventually kept going and found the Institute of Functional Medicine. And so did my certification training with them. And functional medicine, if you're not familiar with, so functional medicine is kind of the study of the root cause of illness. And the way that whole practice works is it uses kind of the same trainings you go through in medical school, but simplifies them and kind of gives it a different spin. And so the thing I loved the most about functional medicine is their ability to kind of diagram out someone's whole life history. And so when you look at the full map of what someone has gone through, it's easy to see where things started to go off, right? And so sometimes it's not just about an infection or an illness of some kind, but looking at what could have caused it. So what emotional or mental things were going on for that person at that time? What other nutritional aspects were happening at that time? What other stressors was that person under that might have caused that illness to begin with? And the most amazing thing about that was that when someone saw their timeline after we worked on it together, they'd be able to look at it themselves and be able to diagnose themselves and see their problem. And I found that the best because that was so empowering for that person, and they were able to take that responsibility of health on for themselves. So after playing with functional medicine and seeing that ability of just mapping things out, the power of that, I was like, this is great. So I still use those frameworks from functional medicine. And they also teach about this matrix. And so the matrix kind of gives you a big picture of all of the systems of health. So, the obvious ones would be like detox or the immune system, but then there's also like communication in the body, and then transport in the body, and then the energy system, and then the mental system, and even looking at the spiritual side of things. So I think it gives like a really good overview of all of these different aspects that are part of life. And the other side of functional medicine that they do teach you on is different and extended labs beyond what we are used to in the allopathic system. So when you go to the doctor for fatigue, for example, right, they'll do a general blood panel and they'll look at your red blood cells, your white blood cells. They might look at your iron panel, things like that. But with functional medicine, it goes a little bit deeper, and these are more private pay labs, but they kind of evaluate things like your stool test. They sometimes look at your hormone panel and kind of a more in-depth look at what else could be going on. And then there's a bunch of different resources that functional medicine kind of trains you on, which is using, obviously lifestyle changes, but then also using things like maybe supplements to provide that extra nutrition or nourishment. And then a lot of the functional medicine practitioners integrate this within their medicine practice. So the doctors that go through functional medicine will often combine this with their prescriptive practice. And so outlining what medications to take for this or that in alignment with these other lifestyle-based elements. Mm-hmm. So that was functional medicine. And then Ayurveda study continued. So I went into that. I've studied different forms of Chinese medicine and Japanese medicine. And I have an interest in so many different areas, Tanvi, so I could keep sharing about all of the different things I've studied. I don't know if you want to go into that more, but that kind of gives you kind of a basic overview of how I started and where that kind of grew into.
Yeah. About what you were talking about earlier with like growing up with that influence, I've noticed that a lot too, because even just like the past few months, I've just like noticed people in my school taking like medicines all the time or having like different pill bottles in their bags that they just take during school. Whereas like for me, if I have a cold, the first thing my mom's doing is like coming to me with like turmeric and ginger shots. So yeah, that's something I noticed too. So going to like into your day-to-day a little bit, what does a typical patient visit look like for you compared to a conventional medical appointment at like a hospital per se?
Okay, so yeah, I mean, hospital would be a little bit different, but if you're comparing like outpatient care, like with like a clinic, so if someone was coming as a family patient versus the integrative practice or the more holistic practice. So I did a lot of walk-in clinic care and family medicine care during my time of practice in that aspect in allopathic care. And that looked like we had lineups because there's such a shortage of family doctors. And so we had lineups outside the walk-in clinics quite often. And so we were encouraged to like make these appointments go a little bit faster, right? And unfortunately, the way that the payment system worked for doctors at that time, I think things have changed a little bit in the last couple of years, but it was a fee for service. So the doctor would get paid per patient that they saw. So the incentive was, right, for doctors to see as many people as they could if they wanted to make a good living. And so when I started out as a doctor on my own, I had just finished training with the Institute of Functional Medicine and learning all this incredible stuff. So I wanted to start applying it right away. And so my appointments ended up going like 40 minutes with people instead of like the 5 or 10 minutes that it was supposed to be. And I spent a lot of time educating people and I enjoyed it. Like I really enjoyed it. So I didn't make much when I first started, but it was so good. It felt really rewarding to be able to practice and see this. But, things started to shift and I had to pace up a little bit more. So the difference was like that time, the time that was available with people. And it was sad because people would come in and they would say, I really don't feel good. I have fatigue. I've got joint pain. I have brain fog. My digestive system sucks. Like I'm constipated all the time and I don't know what to do. And you'd have to look at them and be like, you have to choose one thing for today's visit. They're like, but what do I choose? Like, they're all problems. Like,
Yeah.
how do we start? I found that part very limiting. We would start with a little bit, then I would have to have them come back, every week so we could talk about the next thing. And that was hard because I had to wait in line for each appointment. And so it was a whole day for them to just come in. Whereas in the private practice, what I do is I spend about 2 hours with each person and we go through their entire story. So, and I love this because it gives a person an opportunity to not only share their story, but they're also listening to themselves as they share it. And as they do, it almost starts to relieve the stress of the problem. And so I've noticed that just in itself has been so rewarding. And so in that practice, we do like that longer period of time. We really talk about looking at the bigger picture and trying to connect the dots of like, okay, you've got a headache and you've got the stomach pain. You've also got joint pain and you've got brain fog. How does this all tie together? So kind of explaining to them like what the immune system looks like, what the digestive system looks like, and how these two are connected, for example, right? And so, yeah, to simplify the difference, those would be the two major pieces is really the time.
So given the time difference, and also earlier you were talking about the difference between like typical labs versus like in functional medicine, you said that they go deeper and look at a lot more stuff, look at a lot more things. How would you say in terms of access is integrative medicine compared to like more traditional, I guess like clinical?
So in terms of, yeah, so there's different forms of integrative therapy. And I think if we look at the different forms, so integrative basically means, so I'll start with this first. So integrative basically means that you are integrating a form of non-allopathic medicine with allopathic medicine. So when we're looking at that combination, if we're talking about just MDs right now that are prescribing these drugs or the pharmaceuticals, then those practitioners that have studied integrative modalities, and we'll use functional medicine as an example of one of those integrative modalities, those additional labs cost additional money, right? So the expense involved in getting like a very in-depth picture, like if you're looking at your stool test, if you're looking at your hormone panel, you're looking at maybe other, like a lot of them do like Lyme testing if you've got symptoms of that. So all of these end up costing a pretty penny. And so it can be hard for a lot of people to access that.
Mhm.
So, and then time for the consultation, right, is also a private pay. So even if there is a practitioner who is trained in both allopathic and functional medicine, for example, the allopathic system only pays for a certain portion of time. And then the rest would have to be private pay. And I think in the US and Canada, it's a little bit different with how systems are run that way. But it is more costly to do the functional medicine approach with the consultation, with the additional time, with the extra testing for sure.
So, you bring up a good point with like the difference between countries, but I'm not sure if this would apply to Canada, but how would you handle things like insurance and billing, since many things within integrative medicine typically probably wouldn't be covered?
So yeah, there's a big separation. So I'll speak for Canada, but in Canada, like you have the socialized medical system. So your taxes pay for a certain amount of coverage for your healthcare. And beyond that, then you have insurance that will cover a select few things that the government deems appropriate for that plan, right? That's good for what they think is good for the citizens. So there's only a few things that kind of fall into that realm. So if you are a licensed practitioner, you can often get some coverage under insurances, But if you're not a licensed practitioner, and like, because there's some nutritionists, there's other people that have resigned their license and just using, their training in functional medicine and things like that, those people aren't covered under insurance systems. So it depends on how you're using it and what your credentials are under that designation. So most people can find some resource using the insurance system, but otherwise it's really out of pocket.
If you could change one thing about how healthcare in general approaches wellness and disease, what would it be?
Oh gosh, that's a big question. I feel like I would change the entire system because I think the healthcare system is a very small part of a very big system problem in the West, especially. And I think it starts with like the education system, our food industry, how we've kind of given power to authorities outside of us. So, when you go to school, instead of kids growing up learning about what life is about and how to be curious about themselves and their bodies and learning about nature and how we are part of nature and how nature helps us grow and develop and be disease free, I think that has been ripped away because when we go to school, especially as young children, we're trained to follow what someone else thinks is important for us to learn, right? And then we grow up with that because the education system continues that way. And so we're constantly putting our perspective and our own judgment onto someone else's idea of what should be learned and who we should listen to. Right? So we're always kind of taught to listen to someone else versus what is happening in that moment for ourselves. And so I think that shift starts there at a very early level in the system. But then we look at the medical system too, and we see that because of that way of training over our lives, we also put authority of our health into what our doctor thinks is best for us. Instead of questioning, well, what do I really need? And I think that if healthcare could give that responsibility back to the person, make them curious, make them question, because now, it's almost like people get afraid to question their doctors because they're worried that if my doctor feels upset that I'm questioning them, I will lose a doctor and I won't have someone to go to when I need it. And I think that this is like a really unfortunate piece where that fear is so built in that people are almost afraid to even explore and question and learn for themselves. And I think that's like a really big part of what's missing is taking that ownership back onto ourselves instead of being so dependent on a system.
And on the topic of skepticism and fear surrounding healthcare, especially after COVID and with AI and social media and everything, there's been a rise in like people trying to like self-diagnose themselves or like Googling their symptoms and then coming up with some like crazy diagnosis. So I was just wondering, have you ever like had an experience with these kind of patients and how do you typically go about addressing them?
Yeah, so yeah, you're right. This has been something that's quite prevalent and it's sad because a lot of people are dealing with so many health problems and kind of a lot of different symptoms at the same time. And so when you can't have access to someone that you trust in the healthcare system, or you just don't have access at all, where do you go? And so, of course, people are going to Dr. Google everything and try and find answers. And I don't blame them. Like, I think the first step is even asking the question and starting to look. And I think that there's a lot of false information out there. But I get patients that come to me or clients that come to me and say, I learned this on TikTok, or, someone will be like, oh, should I take more moringa, Dr. Aliya? Like, I heard that it's really good. And I say, yeah, it's an amazing plant. It's got great properties, but you have to see if it's actually right for you because moringa also has properties of producing more heat in the system. And so when you look at it from the Ayurvedic perspective, if you have too much heat in the body, then it causes an imbalance with other elements. And so then you're ending up having different symptoms from taking that on an ongoing basis. So there's a lot of education around, do we take what the new fad out there is, or instead look at that and then take your time to actually do the research around it yourself. Look at the plant, look at the properties, use that as an opportunity to start learning more. And I think there are a lot of great resources out there with credible information. And there's always that question of like, is this real or not? I think making sure you're looking at a few different resources, taking your time to do that education, to learn about that thing that you are about to, take, for example, like the moringa. I think it's important to really look and take that, again, that ownership on yourself to really know that if this is the right thing for you.
I interviewed integrative medicine doctor based in California just a few days ago, and she said pretty much the same thing to that question.
Oh, nice.
And to kind of close off, we try to ask this question to everyone that's on the podcast, but what would you tell either a pre-med student or any young person who's looking to go into medicine who may not be sure of it or is just trying to explore their options around healthcare?
I think the most important thing, and I'm going based on like how I went into medicine, because I didn't really do my due diligence in looking at what the allopathic medical system was about before I went in. I kind of had this magical idea that I would learn about how the body heals. And I think if you take that time to really evaluate the curriculum of what you're being presented with and who put that curriculum together, so you know who's choosing the training you're going into, just like with school, right? Being more aware of what you're going to be learning and why you're going to be learning it and what you want your life to look like. So why, always asking the question of why, like, so why am I going into this? When I finish, what do I want to be able to offer? What do I want my life to look like? And I wish I had had that perspective when I was in that position, because I think that that would really help choose the path that's perfect for you. And it may not be medicine, it may be something close to medicine, or maybe medicine plus something else. And so I think, yeah, being able to really question what it is that you want is important, and asking questions from different types of specialists. So if it is medicine that you're sure about, knowing what that life could look like by following someone in that field and seeing what that life looks like, because sometimes it's hard. You get trapped into ideals put out based on media, right, of what a life could look like in that field. And so getting a better perspective of a day in the life of and experiencing that, I think, is very, very important.
Awesome. Thank you so much. Thank you,
You're
Dr.
welcome.
Aliya, for being here today. I'm sure anyone that listens to this would get to know so much more about your field in integrative medicine and how to kind of approach patients on a more holistic standpoint. So thank you so much for being here.
Thanks, Tanvi. I'm so glad you're doing this podcast, and it was a pleasure to be with you. Thank you.
Thank you.